Hello YouTube world, this is Miss Patty from 4-Year CNA, and I'm here with today's question of the day. But before we get to that, let me remind you to stay tuned to the very end of this presentation to hear the congratulations. We have 3 students we'd like to congratulate on passing the state exam. And if you have passed the state exam recently and you haven't let us know, go to any of our videos, drop in the comment section that you passed the state exam, and we'll be happy to congratulate you in one of our future videos. And if you do that, make sure that you subscribe and hit the bell for notifications. That way you can hear your congratulations video once we post it. So on to today's question of the day. And this one came from Jackie V, and this actually came to us a little while ago. But her question was, are we allowed to put our hand on the resident's chest or stomach for prometric when you're counting respirations? And the simple answer to this is, well, it's not really prohibited, but it's not best practice either. When the patient is laying down on their back, and you can see the tummy rise and fall, anything that's heavy placed on the patient's abdomen or chest is really going to restrict breathing. And you placing your hand on there, you may press down without even really realizing it, which is going to interfere with the patient's ability to breathe easily and can ultimately affect the reading that you get. So that's not really best practice and should be avoided. It's not a failing checkpoint on the state exam, but it's not going to win you any points either. If you're concerned about seeing the respirations rise and fall, you can put something very lightweight and disposable on the patient's chest or abdomen, like an alcohol pad, which is what you see in our videos, and that will help you visualize the rise and the fall of the chest a little bit better without restricting their breathing motions. So I hope that helped. An alcohol pad or a small piece of paper is a much better bet. You can use your hand if you want. It's not a failing offense, but it's not best practice either. So if you have a question that you'd like to see featured on our question of the day segment, go to any of our videos. Down in the comment section, just post your question. I pick one question a day to do a small video lesson on, and tomorrow I might pick yours. If you do drop me a question, make sure you hit that subscribe button and that bell so you'll be notified when we post the answer. And on to today's congratulations segment. And today we have 3 people we want to congratulate. The first is Aaliyah B, and Aaliyah posted, "You're the reason I passed. You're the reason I succeeded. You're the reason I was confident. Thank you." And I just want to tell you, this really touched my heart when I read this comment. Specifically because it says, you're the reason I was confident. And going into the test, that confidence is going to make all the difference in the world. Now, the only way to get confidence is to really understand the skills, to know what's to be expected of you, to practice a little bit before you get into that testing environment. And that will help you pass the state exam better than anything else you can do to prepare, is just practice and gain that confidence going in. And Aaliyah, I'm sure you're going to be a fantastic healthcare provider. Thank you for including us in your journey. We also want to congratulate Tamara Hall. Tamara came by yesterday and said that she passed in Florida yesterday. And she goes on to say she passed all of her skills thanks to you. I studied day and night watching your videos and reading the skills. I cannot thank you enough. And Tamara, we want to thank you for allowing us to be part of your journey. And we're so thankful that you were able to find our resources helpful as you prepare for the state exam. And we want to wish you the best of luck in healthcare. And finally, last but not least, we want to congratulate Cataline F, who passed yesterday and said these videos helped her a lot. And we want to say congratulations and welcome into healthcare, Cataline. And we're so happy that you dropped by to let us know that you passed. So if you guys have passed, or if you have a question, make sure you go to any of our videos, drop your question or comment or notification that you passed in any of the comment sections. I'll get them, and I'll make sure that I congratulate you if you passed or answer your question if we pick it for the question of the day. If you have any suggestions that you'd like me to do a video lesson on, let us know. Or if you've just got an overall suggestion of ways that we can improve, because we are here to help you further your goals. So anything that you think would be helpful, let me know. And we got some really cool things coming up that I'll be telling you about a little bit later on after the first of the year that we're super excited about. But if you've got some ideas, pass them on. We'd be happy to try to implement them for you. So until next time, I'd like to wish all of you a happy holidays and tell you happy caregiving.